We're going to do a quick run through of a chart and how you manipulate the chart as a workup so that you have some idea when you get into the room and you're shadowing people that what exactly is going on. So to start the encounter, one, you need to find the patient on the appointment sheet. We're going to go with patient test here, and we're going to select test and confirm up at the top, test. You also want to confirm their date of birth, and that's up here in the upper right corner, and you want to confirm that with the patient. So when you know you're on the right patient, you want to go to charts up in the upper part of the window, and then you want to select a new chart for today. Now we are using currently retina exam number 2. That may change, and we'll let you know if it does change, but we're going to go retina exam number 2. Now this is going to bring up something that's rather important. Since I have done other charts for today as tests and trials, I get this error window in the middle. And this is an important error window. It says another chart, that this patient has had another chart added today. If you encounter this window, you want to say no, because that means the patient already has a chart. By clicking yes, you're going to create duplicates. So if you don't see today's chart up in this upper corner, you may need to refresh because someone else created a chart just recently. We are going to hit yes, but you basically should never hit yes on this one. It's going to pick an appointment date, and we're going to use the 13th of June, and the appointment type is going to be a same-day add-in. We check that, and we say okay. Are we sure we have the correct appointment date, provider, reason, and facility? Again, make sure it's today's date and the appointment. Say yes. And now it will launch a chart. It takes a second for it to load. And here is the chart itself, and this is where you'll enter data. Now, the first thing you want to look at in the chart is this follow-up window. Follow-ups is filled out when we prep the chart prior to the patient's visit, and frequently it gives us information on what testing needs to be ordered. Testing needs to be ordered when you enter the chart. We cannot do this in advance. It has to be done on the day of treatment. So 29 green is a code for what type of testing that we want to order. There'll be keys for this code in every room, but you'll memorize it rather quickly. Green says that it's both eyes. 2 is a large OCT scan, and 9 is fundus photography. So we'll go down to this order sheet here and say new, and it'll bring us up a window. And we want to order fundus photography, and we say save and new because we want to order another one. And you'll say image, and you'll want to order OCT. Now that's all you need to do. And you say save and close. Now your orders that you just ordered will appear in brown up at the top. And if you have that correct, then you know, okay, I ordered the appropriate things. You'll now go on and obtain the patient's visual acuity. We do things in a little bit of a funny order. We get the acuity and some of this testing first, and the whole point of this is so that we can get dilating drops in the patient as soon as possible. You do not want to hold that to the end. We want to do it up front. So we will do the visual acuity first. You'll take visual acuity like we indicated with the occluder, and we'll get a visual acuity for both eyes. To enter that value, you'll click new, and a box will appear. Now, across the top of this box, we want to say visual acuity, And Snellen here will default, and that's appropriate. Now, if they are not using their glasses, you go SC without correction, distance, visual acuity. If they are using their glasses, you'll go over here to CC with glasses, distance, visual acuity. We very rarely test anything else, so these are the two lines that you will be using. Let's say the patient read 2030, and then two more letters on the 2025 line, so it's 2030 plus 2. We now do the left eye, again, a with correction, distance, visual acuity. Say they got 2025, but they missed one on the 2025 line, so you'll say 2025 minus 1. That's all you need to do here. Say save and close. Now we'll do the external exam. You'll measure pupils, eye alignment, muscle balance, and confrontational fields. So you say the pupils were normally reactive, right eye, and left eye. And it is in this line that you would indicate an afferent pupillary defect if they would have one. You would say whether or not the eyes were aligned, and you want to do this using the Krimsky test like we're going to show you. Eyes are aligned in both eyes. The muscle balance, whether or not they can look up, down, left, and right normally. We're going to say it's normal in both eyes. We'll do our confrontational field, and we'll say that this patient, Mr. Test, has a full confrontation field in both eyes. Then we're going to indicate what drops we're going to use. Now, if we're going to dilate the patient, we will use on most people a combination of phenylephrine and tropicamide. Two different agents. The phenylephrine will activate the dilator muscle to expand the pupil, and the tropicamide will paralyze the constrictor muscle so that the pupil will dilate and won't fight you. We'll also use Fluorox to check the pressure if we're using applanation tonometry. So we say we're going to do that. And we're going to do this in both eyes. So now we've indicated what kind of drops we're going to use. We're going to go ahead and use our Fluorox to measure the pressure with applanation tonometry. And we're going to indicate that here on another window, say new, and right eye, we're going to say, okay, his pressure was 15, left eye also 15, indicating Goldman applanation is how we measured the pressure. We have other options. When you start, you will probably use a tono pen, and we also have an eye care tonometer here that we use infrequently. And we save that, and the number will appear down here. And check and make sure that you saved it. Next thing, we're going to scroll down. We do have this little checklist, but basically you just need to follow the chart. It is designed to help you obtain data points in the correct order. The next thing we want to know is we'll ask the patient why they're here. What is the primary reason that they're showing up? And we're going to say that the patient has distorted vision in the right eye. We're also going to capture here what drops they're taking. And this is a large list. We're going to try to condense that down. But let's just say that the patient is taking a drop for his glaucoma called Combigan. And again, red is right eye only, blue would be left eye only, and green is both eyes. BID is twice a day. So we click BID, he's taking Combigan, both eyes, twice a day. But indicate whatever drops that the patient is taking here. If they are referred by a particular person, and this is a new patient, you can then pick them off of this list. This is the list of people who typically refer to us. This list does change. If they mention someone who's not on the list, you can just free type in this box. Now for the HPI, which is the history of present illness, we want to capture at least 4 data points out of this whole list, because that constitutes a complete exam. So we said he had distorted vision. So we're going to say OD is right eye, OS is left eye, but this patient said both eyes. And he has distorted vision, but he had no pain. And let's say that this has been worsening. And it is constant. That gives us 4 data points here. You can always ask more. What kind of factors change it when it occurs? It says mostly in the afternoon he notices this, and symptoms occur during when he has blood pressure changes. You can put whatever you like in these boxes. You are never constrained by the pick lists, and sometimes it's just faster to type things in if you know what you're looking for here. But that is enough items here in this history of the present illness. We then go down to the patient history. We will have put in dilating drops when we finish the pressure exam. So now the patient's dilating, and we will talk to the patient. We're asking them what their chief complaint is, what their history of the present illness. Do they have any new ocular histories? Say, did they recently have cataract surgery? So we'll say procedures, cataract surgery, and that they've had posterior chamber IOLs. And we'll catch a location, say in the right eye, and say they did it now, cataract surgery 2025, right eye, and say save. A little word, anytime you step away from the chart, you want to say save. In case something happens and you get kicked out of the chart, this allows you to keep what you've already entered. If they have any changes in their medical history, you'd enter it here again with the same checkbox you saw above. Social history, we want to capture if they're a smoker or not. This is a quality data point. We really don't care so much, but the quality measures do require this. We also want to check, does the patient have a current diagnosis of hypertension? Have they had any falls? Inbound referrals is something that your person will go over. The ocular medication and systemic medications are entered through Doctor First, which is this click box. That will take you to another window, and we'll cover that in a separate area. Allergies are entered under this yellow line. We can say new allergies, say, oh, I have an allergy to acetone, and my reaction is itchy eyes. Check that. And you say save and close. And then that allergy appears here at the top of the list. Next, you'll hit the review of systems. You ask them for any other constitutional symptoms, eyes. See ocular exam, we put that on our exam, but say they've had some recent shortness of breath, we can add that here. Mood and orientation is your next box. And say if the mood is normal, confused, they have dementia, we'll say mood was normal. At this point, you want to put the blood pressure cuff on the patient and get their blood pressure to be entered here. While that blood pressure cuff is running, You want to go back through the chart and make sure that you filled everything out, that you have your orders, your vision, your pressures, that all these parts of the chart you didn't skip over and you caught everything. So this gives you a couple minutes while this is running. Then you have your blood pressure, so you'll enter that here and you'll say blood pressure was 135 over 78 and the pulse rate was 56. And you'll say save and close. And now we have a blood pressure for today. You want to say save on the chart. And then you want to exit to the dashboard. And that will then give you the opportunity to move the patient to their next place, either an exam room or the dilating room. This is just a basic overview on how to manipulate a new chart. You will get many times through, but it just shows you what to do. The important thing is go in order, get a consistency about how you go through the chart, and do check at the end for completeness.